In today's world, educating young people is extremely important. One reason being they make up most of the world's population. According to the World Health Organization, of the 7.2 billion people worldwide, over 3 billion are younger than 25 years, making up 42% of the world population. Around 1.2 billion of these young people are adolescents aged between 10 and 19 years. Properly educating adolescents is important because it is a critical period of time as they figure out who they are. Being informed can help adolescents form their own beliefs and prevent health issues. 3 pressing concerns that can affect adolescent health are as follows: sexually transmitted diseases, mental health, and substance abuse. Sexually transmitted diseases can also be referred to as sexually transmitted infections and can be passed from person to person, usually from oral, anal, or vaginal intercourse. It's suggested that half of all new STDs are found in young people ages 15 to 24, which is a very concerning statistic. STD cases in both sexes of young people are rising. Many STDs are asymptomatic, making them hard to diagnose because if a person isn't educated or know they are at risk for having one, then it can go undetected. And then STDs make it difficult to get pregnant and can even be fatal. Ways that we can promote health to avoid STDs is as follows. Education is key to preventing STDs. Children need to be provided detailed sex education before becoming an adolescent so they aren't misinformed by their peers. Nurses need to educate their patients on STDs and sexual intercourse, and nurses also need to educate their patients on the benefits of abstinence and safe sex practices. Another concern for adolescent health is mental health. Depression is one of the leading causes of illness and disability worldwide in teens. Sadly, the third leading cause of death in adolescence is suicide. Mental health is critical during this period of growth because teens are undergoing many changes that can cause them to feel alone and compare themselves to others. And there are also multiple factors that can affect mental health, including stress, social pressures, confusion, relationships, and self-discovery. Ways we can promote mental health is by offering people and societal support to adolescents during this period, implementing programs in schools to help develop positive mental health habits, having trained professionals available to adolescents for guidance, and when nurses are assessing a patient's mental health status, they need to listen consciously and take their emotions seriously. And lastly, the stigma around mental health needs to be erased to ensure those who are affected seek help. A third concern for adolescent health is substance abuse. Substance abuse is depending or overusing addictive substances like drugs or alcohol. Adolescents are at an increased risk as their brain is developing. The 3 leading substances used by adolescents are alcohol, marijuana, and tobacco. 2/3 of students have tried alcohol by their senior year, and 40% of high schoolers have tried cigarettes. Ways we can promote health to avoid substance abuse is starting screening for substance use early. The AAP recommends starting this at around 9 years old. Encouraging the community around adolescents to be mindful of signs that show concerning behavior regarding substance abuse. Educate parents and teens to consult doctors with concerns regarding substance abuse. And teach adolescents about the short-term and long-term effects of substance abuse. Thank you so much for listening.